My name is Zion Ameba, founder of the Mandated Empowerment Initiative, and I have a huge story around how we began the Mandated Empowerment Initiative. But all I can tell you right now is that we had personal experience, myself and my wife, after we got married in 2015, and it came as a result of three consecutive preterms. However, it's now a history as God has blessed us with 3 children. The journey into mental health began when we saw the need to improve and sensitize the general public about the subject matter of mental health. Quite a lot of people at the hospital are not aware that there's another aspect of their health that is as essential, that is as important, even as their physical health. And so I decided, myself and my wife, we decided to see how we can take this as a venture. And we wrote to a lot of facilities, we wrote to schools, we wrote to hospitals, and seeking for opportunity to sensitize, to tell them about mental health, to point to them that there is a need that they give attention to their mental well-being, as it is an integral and a very important aspect of the totality of their health. And we began this journey, and today it's a history. How that we have been able to cut across 13 Nigerian states, how we have been able to mobilize passionate, committed, over 1,000 volunteers across these states. And we are currently working in those states in collaboration with international partners, with government, with the ministries of health and the Federal Ministry of Health, FCT Abuja, and some other stakeholders. And I remember some couple of years down the line, well, again, we believed that to achieve what we wanted to see in terms of mental well-being and the kind of care that should be accessible by Nigerians and by Africans, there was a need to repeal what was then the Lunacy Act of 1958, that was the only tenable law, as touching mental health in the country. And so we've decided to drive a campaign. We decided to drive a right-based advocacy, and we decided to really see how we can get more stakeholders to concertedly drive these and change the Lunacy Act of 1958. And I can graciously have you understand that we found very good hands of the Association of Psychiatrists of Nigeria under the leadership of Professor Sheikh Taiwo. And we began the journey from there, journeying to the 8th Assembly, to the 9th Assembly, and meeting a lot of stakeholders. Some of the meetings running into early hours of morning. I remember where we had some meetings with then the former Chairman Senate Committee on Health in person of distinguished Ibrahim Oloregbe, where we had a lot of conversation. We had a lot of conversation with the government, and we have a lot of collaborations also and support from the WHO, where they are pushed to galvanize ensuring that the Lunacy Act of 1958 gives way to a new legislation that can serve Nigerians, that can bear underneath the human face and be able to cater, respect human rights, and provide access to quality mental health care with the note of inclusion, the inclusivity of the persons who have come down with mental health conditions or illnesses across Nigeria. And this came also under the leadership of Professor Gurje Oye, who was at that time and still currently the chairman of the Mental Health Steering Committee, being led by the Federal Ministry of Health in Nigeria. And I can tell you that Professor Gurje played a very key role in also building and leading this of what we have today as mental health in the country. I mean, I can count so many people who actively contributed, but I can't forget the contributions that came, the consistency of the contributions and the passion that we saw Professor Oye Gurje and the likes of distinguished Senator Ibrahim Oloregbe and many other stakeholders in the country. I also want to acknowledge that the coordinator of the National Mental Health Program at the Public Health Federal Ministry of Nigeria in person of Dr. Tunde Ojo and his team at the mental health program. There was just that synergy and that drive, ensuring that this is done not just for the network, not just for the association, but for Nigerians, so that Nigerians can have access to quality mental health care. And there should be, again, the integration of mental health at the primary health level. I wish I can tell you more about the 5 objectives of this repealed Lunacy Act that came in form of the National Mental Health Act 2021. But then I'm sure you will be able to visit our website and see some of these stories and see some of these objectives. But what stands out is that, look, there is a synergy to ensure that there is quality mental health care that has human rights at the forefront and inclusivity of these patients or persons who have come down with mental health conditions in their treatment plan. And again, I must say that the likes of CBM, a couple of partners, right? Clinton Access Care Initiative, and a couple other of the Leprosy Mission, CBM International, CBM Global, and other private and local NGOs participated actively in driving this. But I want to thank the Association of Psychiatrists of Nigeria for openness and the welcoming that they give to us at the Mandated Empowerment Initiative, that we were able to collaborate with them consistently from the 8th Assembly to the 9th Assembly, and seeing this vision of repealing the Lunacy Act of 1958 see the light of the day. I want to thank you all. But again, we'll talk more about some of the engagement from us at the Mandated Empowerment Initiative. That is a 10-year work consistently in mental health in Nigeria and across Africa.